Good afternoon, everyone, and welcome to the Zenith Global Health Celebrating Excellence in Healthcare Africa edition. We are happy you can join us, and we appreciate your presence this afternoon. I'm just going to say a little bit about Zenith Global Health, and then why we are gathered here this evening. Zenith Global Health was established in the UK in 2016, and our first event in Africa was scheduled to host in Nigeria today, actually. It's a platform for shared learning, collaboration, and celebration. So today we are doing the two aspects of it, which is learning and celebration. And from this, our plan and aim of the platform is that collaborations will evolve from it. So we decided to host Zenith Global Health in Africa to recognize the impact and the progress made across the continent in healthcare, and the hard work and commitment and some groundbreaking work that healthcare professionals across the board are doing in Africa. We just want to say congratulations to all of us for all the hard work during the COVID-19 and for what is to come after that. We know some countries are behind in the R rates and the rest of it. So we know as well that there's a lot of work to do. So we welcome you. I'm Mary Akongbe. I'm the founder and president. I'm an award-winning author, mentor. I'm a mentoring actually crossed across the globe and focused on Africa, transforming healthcare. And I've been doing that for about 11, 12 years now. I started my training in Nigeria, and I'm now a specialist practitioner in minimally invasive surgery with focus on health technology and robotics. That's what I do. I teach and train and build capacity on that. And I've been involved in many fests, both in this country, in Europe, and beyond. And actually, I've been fortunate, which is one of the aims of Zenith Global Health, to work with a lot of people who are doing first in their field, and especially minimally invasive surgery across specialties. I've been involved in setting up first. So sit back, enjoy, learn, and yeah, we're going to have a great time. And I'm going to hand you over now to Juliana, our amazing moderator for the evening. Thanks, Juliana. I'll let her do justice to her introduction.
Mary, thank you so much, and welcome everybody to this amazing event. I'm very, very proud of Mary because, of course, you can imagine, as I'm sure we've all experienced, a complete disruption to our lives. And I know about this time, we should have been in the Oriental Hotel in Lagos, sipping on a cold glass of orange juice, if that's your preference, but we're not. But Mary decided that because celebrating healthcare professionals, and remember, this was already planned before COVID, that was her utmost priority. And having successfully done so in London for several years, she decided to go back to where the recognition is possibly needed the most, which is to Africa, specifically Nigeria. Just going through some of the bios, I believe there are hundreds of years worth of experience and expertise here. And so hopefully we'll be learning from all of you. So thank you once again, and do bear with us because Mary has put this all together by herself really over the past couple of days. And we thank her so much for all of her hard work. So without further ado, we'll go straight into our, in fact, let me introduce myself. I'm Julia. Some of you may or may not know me. I'm a journalist, used to be an investigative journalist here in the UK, but over the past couple of years, I've really focused my skills on Africa and Nigeria and really helping to shape that positive narrative from the diaspora. I'm currently the face of Channels TV in London. I'm sure many of you know Channels TV. And I focus on business. And of course, we know business envelopes every sector, including health, as we're seeing with COVID and all of the monies that need to be raised to help everybody. And Mary was very kind enough in asking me to help moderate this evening, and I'm very grateful for that. So yes, the program for the next hour or so will start off with us really highlighting the nominees for the various categories of awards. The nominations are still ongoing, so please, when you do see these categories, do nominate individuals within your practices, within your network. Please share the event and let them know the award ceremony will still take place. A date will be sent out to you, but because they've all been patient and they would have all been waiting to see whether they have won this evening, we did say that we would at least acknowledge them. We will then be having a keynote address presentation by eMQT. I'll allow the two wonderful ladies, Dr. Tina Barton and Shalom Lloyd, to explain to you exactly what that is and what they're doing and what they're promoting when they give us their address. And after that, we'll proceed on to the presentation of the Special Recognition Awards. We've got some really, really great, highly revered people on this platform this evening, and we must recognize them, particularly during this awful pandemic that we're going through. So many of us have put so much on the line, not just within COVID, pre-COVID, and I'm sure we'll be doing it post. We also have a Lifetime Achievement Award, which we will be presenting to somebody who we respect and honor and are grateful for. And then, of course, as you've all been into these webinars before, we'll also be having some feedback. And please feel free, even as the session is ongoing, to put your suggestions and messages and anything you want to put in that box. And then, of course, like I said, the opportunity to nominate individuals for their outstanding work, as the ceremony will be taking place later on in the year. So we can move forward. So now we are going to be announcing who has been nominated for these various categories. Unfortunately, not everybody will have an opportunity to speak this evening. Again, we know webinars can get a little bit messy at times, but we do want to recognize them because they have been nominated, and who knows, within the next 6 months or so, they may be a recipient of the actual award. So for the category and partnership in healthcare, nominated are Dr. Yewande Alimi, AMR Program Coordinator for Africa CDC, Raphael James as a Wellbeing Counsellor. Congratulations to the two of you. For the category of Outstanding Team of the Year, we have Medicaid, Radio Diagnostics and Clinics in Nigeria. Please forgive me for my French. The Centre International de Recherche Médicale de Franceville. Congratulations to you. In the category of Excellence in Nursing and Midwifery, Reddington Multi-Specialist Hospital Group Nurses in Nigeria, Kelvin Odonko, Mental Health Nurse in Ghana. Congratulations to you. For the category of Healthcare Sciences, we also again have Medicaid Radio Diagnostics and Clinics, and again, Dr. Yewande Alimi. For the category of Health and Social Care, we have Peter N. Githura, Public Health Specialists in Kenya. We have Omotayo Kidney Foundation in Nigeria, and Good Hope Nyahururu Hospital. For the category of Rising Star, we have one individual here, Ephraim Kumi, who's a pediatric lead nurse in the Cape Coast Teaching Hospital. For the category of Medical Imaging, we also again have Medicaid Radio Diagnostics in Nigeria. It's a popular team. And now we're going to be passing on, and we're moving on to our next really important part of the session. And this is the Emerging Markets Quality Trials eMQT keynote address, which will be delivered by Dr. Tina Barton and a good friend, Shalom Lloyd. Dr. Tina has a long and varied career in clinical research, and for almost 40 years, and she's been running large and small teams in the NHS, the National Health Service here in the UK, pharmaceutical companies and clinical research organizations, some small, some startup companies, and several global corporate entities. Tina has always had a passion for developing new medicines. She struck a long track record in managing change, continuous process improvement, and driving growth through strategic leadership. Very brief bio there. And Shalom Lloyd, who I'm sure many of you are familiar with. She has, amongst many other things, a BSc and MSc in pharmaceuticals from the Ukrainian Academy of Pharmacy and an MBA from the University of Liverpool. Shalom has over 20 years of experience in the pharmaceutical and CRO industry, making a difference to the lives of patients in emerging markets, particularly Africa and Nigeria, by championing the provision of targeted innovative medicines aimed at the needs of individuals is a true passion of hers. I could go on and on and on, but I know it's in the evening. We've got plenty to do. So without further ado, I'll hand over to our two keynote speakers. Thank you very much.
Thank you so much, Juliana. Can you hear me okay?
Yeah.
Wonderful. Thank you very much. It is really an honor to have eMQT present at this amazing celebration. Myself and my colleague, Dr. Barton, are really pleased to be here. As Juliana had said, this is a great celebration to actually recognize amazing healthcare professionals who are doing great work in Africa. It's also a chance for people to continue to nominate because obviously with COVID-19, we weren't able to actually have the celebration physically, but it will happen later in the year. So my name is Shalom Lloyd. I am co-founder and Chief Strategy Officer at eMQT. And I'll hand over to my colleague, Dr. Barton.
Shalom, thank you. Mary, your team, thank you so much for putting on this amazing event. As Shalom has just said, it's a real pleasure and an honor for us to be asked to speak to you all this evening. Next slide, please, Shalom. As Juliana already said, I have a long established track record in pharmaceutical medicine, but what for me it's all about right now is bringing that to Africa. We want to bring the miracle of new medicines, new opportunities to the African patients through their involvement in pharmaceutical-led clinical trials. So let's have a little look about what that means. I've been involved in global clinical trials for pharmaceutical companies for a very long time. If we look at this road and this journey that I've been on, we started with the arrival of ICH-GCP back in the late 80s. And at that time, North America, Western Europe, Australia were all involved in those studies. And then as time moved forward, expansion went ahead into Eastern Europe, and those countries got involved. Amazing clinicians we worked with, a lot of treatment naive patients, and that really allowed drug development to move forward apace. That continued as we went on into the 2000s with expansion into Latin America, India, China, Asia. More patients, more access to new medicines, and more opportunity to ensure that people got the best treatment that they could. So for me, it's now Africa's turn. Africa really needs to be part of that journey and part of that group of people that have that opportunity to get new medicines before others might, and to be able to be represented in those global clinical trials. Last year, in 2019, the FDA mandated that clinical trials really need to show a better representation of the world's population, and they're looking for increased diversity in all their global clinical trials. Next slide, please. So why does it matter? I think, as I just said, African patients are not appropriately represented in clinical trials. Those people make up 17% of the world's population. But if we look at clinical trials for commercial drug development, it's reported as less than 3% are Black Africans. Currently, 95% of cancer patients in sub-Saharan Africa are reported as being diagnosed too late, and then what treatment is available to them. It's a very stark and challenging piece of information. We know about the rising billion. It's talked about a lot in respect of Africa. And we know that also we've got a rising GDP and a lot of consumer power. So it's offering now a really attractive therapeutic market as well. So this population in Africa, it offers drug-naive patients, multiple disease areas, and they're accessible to all of us through the work that we do, through careful planning and engagement. Next slide, please. So let's think a little bit more about why we should work in sub-Saharan Africa. And that's the focus for eMQT. This is what we want to do. We want to bring those global clinical trials to this area of the world. We've already had the opportunity to travel and meet some of our colleagues on the line here tonight and others that can't join us, and be very overwhelmed by the work that you're already doing. So let's make that be part of the global clinical trial environment. You have the patients, you have loads of talent and enthusiasm, and there's a real opportunity here to use the technology and innovate in the way that we work so that you can become part of the global program of clinical trials worldwide. So for me, the current model for pharmaceutical development that focuses on other areas of the world and excludes Africa primarily, does not open the opportunity for your patients to access new developing medicines across the multiple therapeutic areas that your patients deserve and they should have the opportunity to have access to. So that's our passion, that's what we're trying to do, and I'm going to hand you over to Shalom now to tell you more about us.
Thank you very much, Tina. So Tina has gone through why Africa, but I wanted to, as an African woman, also talk about why Africa for me. From 2013 to 2020, emerging market economies were forecasted to grow 3 times faster than developed economies. I won't go through the numbers again, but as Tina mentioned, 1/3 of the world population, even more than 1/3 by 2050, will be in Africa. What that really means is Africa will add 3.5 million more people on this planet per month. That's 80 additional people per minute. And for those of you on the call who are from pharmaceutical companies and biotech companies, Africa really is a strategic market for pharma. Africa has the experience, the expertise from healthcare professionals. A lot of them are on the call today. It is a challenging but dynamic continent. We have the expertise. A lot of the people here have experience currently working in clinical trials, investigator-led trials, and non-commercial trials. But Africa has to be ready. We have to be ready for VUCA. We have to be ready, remove the VUCA, remove the volatility, remove the uncertainty, remove the complexity, remove the ambiguity. And to do that, we really need to work on improving our infrastructure to enable us to build centers of excellence. We already have amazing hospitals, community hospitals, and there is a genuine willingness to build in Africa. We have the experience. Like we've talked about before, we will build on the non-commercial experience to ultimately reassure pharma companies and biotech companies that we have the well-educated people, people who are hungry to learn, people who have access to patients. In terms of culture, Africa is rife with culture. We have to respect our culture, but at the same time, that culture should not be a hindrance, but we should adhere to global standards. Let's recognize the cultural differences, but make culture a catalyst, an enabler to support the ease of doing business. And of course, ethics and regs as well. Having the ethics and regulatory processes ready to meet global standards is so, so important. it can't be a bottleneck for us. If we're able to get our infrastructure, experience, culture, and regulatory environment right, and tackle and remove the VUCA, what we'll deliver to the global platform is a sustainable operations and compliance in terms of our centers of excellence, built on a foundation of leadership and direction. We're already nurturing talent and already training a lot of people. If we do all of that, Africa benefits and pharma benefits. For those of you on the call, the amazing healthcare professionals in Africa, your patients will have access to medicine, patient education, they will have more treatment options and greater medical care. For your clinical teams and your sites, you will have the opportunity to be part of global clinical trials, increase your expertise and professional standards. And of course, ultimately, the patient is at the core. So you being able to provide your patients with better treatment options is amazing. Your hospitals across the region and the countries across Africa bring in global commercial clinical trials to Africa with increased income, growth, employment, education, and will be able to play at the level field, that global platform. For all the pharmaceutical companies who are here as sponsors, what you get is diversity of data. You will get compliant data. The patient numbers, as we keep saying, are there. They're treatment naive patients. And also the ability to have faster recruitment and in some cases, shorter timelines. They say a picture speaks 1,000 words. So we at eMQT wanted to really show you on ground what we're doing. These are some images from site initiation visits and training where we offer also ICA GCP training. And we really want to say thank you so much to the sites who are working with us in Gabon, in Congo, in Brazzaville, also Damax in Tanzania. We really appreciate you guys, and you're really working hard with us to bring Africa to the global playing field. And Tina and I wanted to show this slide just to show you the VUCA. 5 days, 7 flights, 4 African countries, 3 languages later, with only 2 hours sleep in 36 hours. But the key thing is that the sites, the healthcare professionals were waiting for us. They waited for 8 hours, were delayed, but they were there, ready, experienced, and ready to learn, absorb, and ready to kick off our project. And for that, we really thank you. At the core of everything we do, it's all about patients. And we're all for patient education and patient engagement. The images you can see here was us in northern Nigeria, in Kaduna, and we were talking to sickle cell patients. It was World Sickle Cell Day yesterday, I think it was. And these patients were hungry for information and were very engaging and very interactive. So the patients always remain at the core of everything that we do. If we have the knowledge, the standards, then diversity in clinical trials becomes the norm. We'll have access to medicines and treatment options. Africa will be included in commercial clinical trials. We can only do that, though, if we're open, if we educate ourselves more, if we share knowledge amongst ourselves and build the experience, if we really understand the global standards and not cut corners, and if we continue to build our centers of excellence, as we're doing in Congo, Brazzaville, in Gabon, in Tanzania, etc., in Nigeria. And the ultimate goal is for African countries to be included in global commercial clinical trials as standard. That is our goal at eMQT. We want a sponsor to have a protocol that says, okay, we want this number of patients from Africa. That will be a dream come true. And all of you healthcare professionals on this call will help us get there. Our aim at eMQT is to transform healthcare research in Africa. Diversity improves outcomes for everyone. So we see ourselves as that bridge between the pharma industry and Africa, utilizing your expertise as healthcare experts and professionals. And Africa is virgin ground. We can bring in innovative technology to provide pharma companies ultimately with access to patients and high quality evidence patient data. And for the patients, they will have access to miracle medicines that they wouldn't typically have access to. So we thank you so much for listening. We hope everything that we said really resonates. Please feel free to contact us with any questions that you have. I think the slides and the recording will be made available to you. On behalf of myself and Tina, we really thank you for giving us a few minutes to address you today. And congratulations again to all the amazing, amazing recognized people today. Thank you. Back to you, Juliana.
Wow, Shalom, thank you so much. And Dr. Tina, thank you. African countries as standard in global clinical trials. It sounds so straightforward and, you know, like common sense, but we are so far yet so close. It's such an important project and initiative, and I hope everybody is going to get behind what Shalom and Dr. Tina are doing. There are a couple of things that stood out: infrastructure, experience, culture, ethics, and regulations. Something that the majority of us in the sector are obviously doing and understand and have built, but there's such a long way to go. And I think COVID-19, I'm sure we can all agree, has really exposed some of the issues we have in healthcare, not just in Nigeria and across Africa, here in Britain, because of course we have some of the worst death figures from COVID-19, and there are so many lessons that can be learned. So thank you, Dr. Tina and Shalom, for addressing those issues. So we're now going on to one of my favorite parts of the session, which is the presentation of the Special Recognition Awards. And just to warn you, recipients, you will be invited to speak only for a couple of minutes, but we'd love to hear more about you, what you've been doing during this pandemic and some of the projects that you're working on. So without further ado, we'll go on to our first individual, who is a lady who I respect and admire so much, Her Excellency Dr. Zainab Shinkafi Bagudu, who I'm sure many of you already know. She is the First Lady of Kebbi State. She's more than that. She's a consultant pediatrician and an advocate for women's health. I think we have some feedback, so if anybody isn't speaking, if you could please mute your mics for me, that would be fantastic. She's an advocate for women's health with a particular focus on cancer. Dr. Bagudu obtained her MBBS from Ahmadu Bello University and specialized in pediatrics and neonatology in the United Kingdom. She has a master's in pediatrics, a diploma in tropical child health, and is a member of the Royal College of Pediatrics and Child Health. There's so much more, but again, our time is limited. So if Her Excellency Dr. Zainab Bagudu is here, we'd love you to unmute your microphone and please address the audience. Thank you.
Good evening, everybody. It's a pleasure to see you all. I hope everyone is safe and doing well. It's an honor to be here and to have been nominated for this special award, as well as the Medicaid Diagnostic Center. Unfortunately, the occasion was moved due to a disruption, something that happened to the world that we all least expected, the COVID-19 pandemic. And has been a very serious wake-up call for those of us that are involved in delivering healthcare services, and especially those of us that are practicing in Africa, in developing world settings. It has shaken the way we practice, the way we live, the way we interact socially and in our work as well. Yes, my husband is the leader of a state, and I support him in that on that platform, but I also still have my primary constituency, who are my patients, whether they are the cancer patients that I support or my pediatric patients. So in all these respects, the COVID-19 has really disrupted our lives and our work, and we are finding ways in which to keep on living with it. It disrupted our lives and our work, I keep on saying, but it has been a wake-up call and a reality for us, and it has shaken us and is telling us how much we have to do things differently, how we have to really start to interact with our system in a better way, and make sure that, in particular, our diagnostics and our healthcare delivery systems are stronger. I am pleased to say that a lot of the responses from both the public and the private sector in Nigeria has risen to this call, be it warranted or not, or be it expected or not. In Kebbi State in particular, there have been a lot of responses both in the public and private sector, and people are really rising up to the task, and the government has done a lot. I will not bore you with those details, but there have been good responses acknowledged by partners. The WHO and all have acknowledged the responses of Nigeria to the COVID-19 pandemic. So I won't talk for too long. I thank you once more for the invite and the honor that have been bestowed upon us. I continue to dedicate my life and my work to improving the lot of women and children. And I will not stop without saying a little word about what we are doing right now, which is focused on gender-based violence. At any point, there is a lot of issues that happen to us in our environment. And right now, there is a lot of focus on talking and trying to get the right laws passed for particularly the northern states of Nigeria that need to be in place for stopping rape and gender-based violence against women and any other persons that so be it, that might be at risk. We're working alongside all my other sisters. The COVID-19 pandemic again is being blamed for this because of the lockdown periods. Obviously, a lot of tension, a lot of stress has been going on, and we are trying to use the outcry and the resultant effects that have come out of that to get the laws passed. But the laws are just one thing, but we do need a lot of social reorientation to ensure that our people start to look at the way that women are treated in a different way, so that we can actually have a changed mindset. And most importantly, the reason I decided to mention it before going off is to have a different thought process and a social reorientation at the grassroots, so that people can start to think about the way that women are treated in a different way, and a mindset change, and speaking up about it openly, and stop the culture of silence, whereby when people are being abused, they think that it is wrong and culturally not right to talk about it, particularly again in my part of the world. So I'd like all those listening, the panelists, the attendees, to join us in this fight and ensure that we keep speaking about it openly. Our reality is a totally different reality from those of you that are joining us from other parts of the world. I am not saying that we will enforce the laws or the researches that have been done in your parts of the world. Our experiences are different. We do have our own realities. However, what is wrong, and what is right. And we have to get these things passed, and the time to do so is now. So thank you very much, and have a nice evening. Juliana.
Wow, Dr. Zainab, that was extraordinary. Thank you for setting the tone. I've got to commend you for the work that you're doing for voiceless women, not just in your region and across Nigeria. I know you've traveled extensively across the world. It's commendable. Thank you so much. And it's, you know, those voices that we mustn't forget during the lockdown, because it has so many knock-on effects, doesn't it? So congratulations to you, Your Excellency, and Medicaid for all of the wonderful work you are doing. And we'll see you in Nigeria. Let's now move on to our next recipient, who is Dr. Akinosho Olujumi Coker. Apologies. Dr. Coker is the Chief Executive Officer and Consultant and a general surgeon at Lagoon Hospitals, Lagos. He qualified from the College of Medicine, University of Ibadan, Nigeria, and had his specialist surgical training here in Britain. Dr. Coker is also a graduate of the Advanced Management Programme at INSEAD, European Institute of Business in France. He worked as a lecturer and consultant surgeon in the UK, was a surgical instructor to Tropical Health and Education, which is a UK-based charity. There's much, much more, of course, but I'll hand over to Dr. Coker for a couple of minutes to give his acceptance speech and let us know what he's also been up to. Thank you.
Dr. Coker, his video is not activated, it's not online at the moment. So not everybody who's a nominee has their video activated. So he's one of the people that doesn't have a video activated. And I don't believe that either of the two other people in this category have their video on either. I know Stella Akinso was on earlier on, but I don't see her video now. So.
Okay, is Dr. Coker, if you're here and you can unmute yourself, we'll give you a couple of seconds before we go on to our next recipient.
Yes, he said he's on the line, so he should be able to speak. I will see if I can unmute him.
Okay.
Just hold on, I need to find him in the list.
We'll move on to, for now, Dr. Ayo Shonibare, and we'll come back to Dr. Coker. Dr. Ayo Shonibare is a urology and renal transplantation specialist. Sorry, guys. He is also a consultant urologist and kidney transplant surgeon with over 30 years of experience gathered across several healthcare institutions in Nigeria and across the globe. I'm sure many of us know him. He qualified as a medical practitioner from the Royal College of Surgeons, Ireland, in 1985, 35 years ago. And he was awarded the Surgical Fellowship of the Royal College of Surgeons in 1991 and returned to Nigeria in 1993. I'm sure many things happened after that, but again, I'll hand over to Dr. Shonibare if he is here. Dr. Shonibare, are you here?
He's not on one of the videos, so
Okay. Are we anywhere with Dr. Coker?
I'm just trying to find him in the list of participants, and I will allow him to talk as soon as I can find him.
Okay.
So if you'll bear with me. We have a very large number of people participating this afternoon, which is great, but it means that there's a lot of scrolling down to find the right person.
That's fine. We'll just mute you whilst you're doing that.
Okay.
And, we will go on to Stella Akinshaw. There's so many people we're recognizing tonight, so we've got a lot of time to fill. She is currently the team lead at NURHI. Stella's a British Chevening scholar with over 30 years in social development programs with focus on maternal and child reproductive health and family planning, advocacy, research, training, and clinical service position. Is Stella Akinshaw here? Stella, if you're here, please unmute yourself. Yes.
Oh, yeah, yes, I'm here. Can you hear me, please? Can you hear me?
Perfectly.
All right. So good evening, everyone. I'm so grateful to be here. I'd like to recognize and appreciate Mary and for those who actually nominated me. I've been in reproductive health for over 30 years. I worked while working at the Fertility Research Unit. We did a lot of work to strengthen the capacity of health workers to ensure that they have they're able to provide quality care even to their patients. But currently, I'm working with Johns Hopkins Center for Population Program and under a project that is called Nigerian Urban Reproductive Health Initiative. I've had experience, about 6 years experience with UNFPA, United Nations Population Fund, and then of course 1 year with USAID, and then currently working with this project. In my 30 years of working, what I have noted is that in Nigeria, we have only contributed 2.3% to the population, but we are contributing 20% to maternal death. And a lot of these deaths are needless deaths. And a lot of them also occur because women and young people do not have access to good reproductive health care. And because of this, I became so passionate about, getting women educated, strengthening the system, ensuring that, we build the capacity of healthcare workers to be able to provide services to people so that women who have too many children or who have them too closely or to have them when they are not supposed to be having children when they are older, and we can reduce morbidity and mortality among these categories of women. So in the first case, in my work with UNFPA, what we did was to ensure that we sponsored a bill to put an end to female genital mutilation with other colleagues, working with women, lawyers, and so on, so that we can end female genital mutilation in Osun State. It's across Nigeria, but typically it's very, if you look at the percentage of female genital mutilation, it's quite high in the state where I was working then. But back to Oyo State where I am now, when I came on board, what we realized was that women are having pregnancies that they do not actually plan to have. And so this has resulted in child abandonment, abortion and all the likes. So what we did was to do three-pronged approach. The first one is to ensure that we advocate to policymakers to ensure that they have good policies that support funding for family planning and reproductive health and maternal and child health. That was a little bit, a Herculean task because there was no budget line for such. All of the things that we're doing were dependent on donors. And so want the government to put all of this in the front burner of their, of their policy and to be able to fund it, not only talking about it, but to be able to fund it. So we were able to get that fund from the budget line for family planning and for reproductive health. And so much so that we were able to actually sponsor a bill, what we call family planning and reproductive health bill. It took us such a long time, almost 5 years, but eventually we got it right, and then the bill came into law just in 2019, early 2019. But recently with the COVID, what we have found out is that there's so much, particularly during the lockdown, quite a number of women were being molested and violated, a high rate of rape and so on and so forth. So what we did was to ensure that the community, we engage the community members and let them know that they need to speak out because there's a culture of silence. Now, there was a particular lady, a 15-year-old lady that was raped by the uncle, and we followed through. But unfortunately, the family was not ready to actually take it through to the law enforcement. After taking her to the hospital, following her and getting her a lawyer.
There's so much, but I will have to move you on shortly. But please wrap up. Thank you, Dr. Stella.
Okay, so we're so much so this is what we've been able to achieve, in the work that we do. I want to thank you once again for this recognition, and I appreciate that.
Dr. Stella Akinshaw, congratulations. Thank you so much for all of your hard work in family planning and reproductive health. We're so limited for time, but there will be an opportunity to speak when we're all together again at the ceremony. But thank you so much. I will like to ask before I move on if we do have Dr. Coker or Dr. Shonibare online.
We have Dr. Shonibare. He is in the list of panelists, and now he's unmuted himself, so we'll just be able to hear him. Let's see.
Yeah. Good evening, everyone. Can you hear me?
We can hear you. Is this Dr. Shonibare?
Yes, this is Dr. Shonibare.
Congratulations, Doctor. We'll just give you 2 minutes. Thank you very much.
Okay, thank you very much. It's truly an honor and pleasure to be recognized today, and I would like to thank Mary and the people that actually nominated me. Basically, I came back to Nigeria in 1993 after training as a urologist and vascular surgeon in the UK, and came back to discover that with the prevalence of kidney failure, patients they did not have access to kidney transplantation. So took it to pioneer this work, and in year 2000, we managed to start a kidney transplantation program at St. Nicholas Hospital, and we grew this program, and also I wanted to build capacity, so I initiated a program at UCH in Ibadan. That was in 2009. And then in 2015, I also trained some surgeons to start a program at the Lagos State University Teaching Hospital. So basically, to achieve this, we actually partnered with Hammersmith Hospital in the UK and Queen's Hospital in Birmingham, so that they were able to teach us the latest techniques and minimal access surgery. Right now, I'm involved with some other pioneering work. We're building a world-class 165-bed multi-specialty hospital in Lagos. The COVID threw a spanner in the wheels. We were supposed to open in April, but we actually plan to open in October towards the end of the year. So we want to offer accessible, affordable, high-quality care to the low and middle-income population in the community. So we look forward to opening this, to transforming healthcare in Nigeria. So I'll keep it at that in the interest of time. Thank you very much.
Dr. Shonibare, congratulations and thank you. Wow, a multi-speciality hospital in Lagos. That will be excellent and we can't wait to visit. Good luck with the development there. Can we ask if Dr. Coker, is Dr. Coker now available?
He's not, he's not, no.
That's fine. Let's move on to our next recipient, who is Dr. Efumbo Doshekun, who is a women and children's health specialist and the CEO of Outreach Women and Children's Hospital Group. Is Dr. Doshekun here?
Can I just interrupt you a second, because we do have Dr. Coker. So if we could stop the sharing of the video, and Dr. Coker, his video is online now. So if you just go back, Dr. Coker is able to speak now.
Dr. Coker, congratulations. We're happy to have you here. Time is short, unfortunately, but we have a couple of minutes for you, of course.
Right. Well, thank you very much. And I would like to thank Mary and her colleagues for this award. I really do appreciate it. I trained in the UK, as you alluded to in my CV. But in 2010, I decided to come back to Nigeria because I felt that was where my skills were needed most. This started with the West African College of Surgeons conference in Calabar, when the UK West African College of Surgeons Forum hosted an outreach program there. I then joined the Lagoon Hospitals Group in 2010 to start accreditation with the Joint Commission International. My passion is to change the narrative for healthcare in Nigeria because I feel that a lot could be done and a lot could be achieved. So because of that, what we've done is to collaborate with teaching hospitals, where I am a lecturer at 2 of those hospitals, training surgeons. We founded the Laparoscopic Surgery Society of Nigeria. I'm the president. And really, I feel that we need to change the narrative of laparoscopic surgery, because at the moment it's still a mystique, it's still mystified, and people always get scared of having surgery. So we need to encourage people to have, these sorts of operation. Currently, the work I'm doing is with the Society for Quality Healthcare in Nigeria, where we, as the chairman of the technical committee, we have developed accreditation standards developed in Nigeria for Nigerians by Nigerians, which has received ISQA accreditation, and we plan to roll this out after the COVID-19 pandemic. So again, thanks very much. I do appreciate this award, and I'd like to thank Mary and her colleagues again. I hope you all have a lovely evening. Thank you.
Thank you, Dr. Coker. Definitely worth the wait. Developed in Nigeria by Nigerians for Nigerians. Excellent. That's exactly why we're doing this event tonight. So we'll go back to Dr. Doshekun. Dr. Doshekun, are you here?
Yes, she is here.
Hi. Good evening, everybody.
Please mute you, David, please.
So would I have the screen? Good evening, everybody. I'm Dr. Doshekun, the CEO of Outreach Hospital Group, and I appreciate Mary and her team for this event and for, finding a dim fit to recognize people who have devoted their lives to making the lives of others better in Africa. My journey in outreach started around 10 years ago, coming back from England and being so convinced that it is possible for there to be change in the statistics, the health statistics, the survival of babies and children in Nigeria. And we have been very fortunate, we are humbled that a small team in outreach is like going from a little a small branch. We've been able to set up 5 new branches where we give service not only to babies, to children, and to women. We have found ourselves at a very beautiful position in the world of global development, in that we at Outreach are now able to say we've cracked it. We have found, it's a eureka feeling. People, doctors, nurses, health practitioners who have worked in the developed part of the world already have the mindset that it is very difficult to create change, to save lives, reduce morbidity, and make people happier in Africa because of all our challenges. And people in Africa have the mindset that things are too difficult, we can't abide with standards, global standards, we just have to come to terms with our difficulties. But the outreach story is different. The outreach story is one of facing challenges, being a detective in terms of your public health, detective in terms of being a clinician or a diagnostician, and making the best of a bad situation. We've worked, our organization, though it's a private sector medical service or health service provider, right from the beginning, our motto is that we must save lives and we must be impactful. And we've done that by working with government, we've worked with academic organizations, we've worked with NGOs, improving the lives of babies, children, and women. We currently have neonatal intensive care, which has done some quite incredible things for the funds in which we have received from the patients. It's like almost 2% of what they would pay if they were outside in the higher income countries. And our smallest baby is a 24-weeker, and we have quite a few 24, 25, and 26-weeker preterm babies who we've been following up and extremely impressed with their development.
Wow.
In summary, what I'm saying is that for Africa, don't lower your bar. In terms of technology, there's a lot of need, and there's a lot of need for us to leapfrog in technological advances, because interventions now are more practical, they are cheaper, and they are easier to achieve. Important thing is to be goal-directed, and that is what we have done in the outreach group. I thank you once again, Mary, for giving me this opportunity and recognizing me. Someone must have recognized the work that the outreach team are doing, because we are for the masses, the working class, the active poor, and we have been very practical in our approach and have got the results that we anticipated. So congratulations to everybody too.
Congratulations, thank you so much. We must save lives and we must improve. Such a strong statement, and thank you for looking after all of the small children there. We're swiftly moving on. Please bear in mind that this is Zoom, so we only have a certain amount of time. So we're going on now to Professor Wale Suleiman. Professor Wale Suleiman is an accomplished neurosurgeon and researcher. During his time in the States, he was the system chair and co-medical director of Neuroscience Institute, as well as a medical director of international medicine for Africa. The list goes on and on. I'm so sorry I can't read everything, but we will be putting it online so all can share. Is Professor Wale Suleiman in the room? He is. He's been here patiently. Over to you. Congratulations.
Thank you very much. It's a pleasure to be here, and I've enjoyed your pronunciations. You're doing an amazing job. I'm humbled and honored to be here. Thank you for the recognition. I have to especially thank Mrs. Mary Akongbe and Paul Hogan for seeing it fit to nominate me. I thank the organizing committee and other participants. It's an honor to be amongst the people that have been recognized so far. You've mentioned some of the things I've done. Up until August last year, I was based in the United States. I'm a professor of neurosurgery and neuroscience at Tulane University. MD and a PhD in neurosciences, clinical neurosurgeon. And, we did a lot of what we do in the Western world, and we feel very proud of the thing we've accomplished. Up until I came back, I was running a top 25 neuroscience program, over 200 physicians, 500 employees, over $500 million revenue. But you kept saying, if you stop doing what you do, would there be a significant vacuum? Would somebody else be able to step in and do what you do? And if you didn't do what you're doing in Africa or in Nigeria, would somebody else be able to fill the void? And the answer all the time to me was no. So I came back in August, and my current roles are kind of be confusing. So I'm the CEO and chairman of Zenith Global, which is a hospital management, operations, and development company. Well, I'm also a co-founder of RNZ Foundation, which we use for our philanthropic efforts. Over the years, we've organized a lot of medical missions. We've taken a lot of fellows, about 100 fellows to New Orleans for training, nurses, doctors, surgeons, mostly focusing on this patient-centered and team-focused, team-based care. And a lot of them have come back and then became trainers or trainees, and they've gone on to do amazing things. So you see what is, and then in August, I took a post of special advisor to Governor Abdulrahman Abdulrazak on special advisor on health matters, and we're now leading the effort against COVID-19. But I want to emphasize the reason why we do what we do. We live in a country where, we have a young 40-year-old walking around with a systolic blood pressure of 200 and is being told to go and rest until he comes back with a stroke. We live in a country where a 60-year-old will go to a doctor and with acute back pain, he will be told to go home and rest, keep put on steroid until he comes back with a GI bleed and very unstable in the hospital and potentially lose his life. We live in a country where a 16-year-old would have an incomplete spinal cord injury and will be put on traction, which nobody else does in the world, until that incomplete spinal cord becomes complete and they are devastated for the rest of their lives. So
Prof. Suleiman, I'm so sorry, I'm going to have to usher you as quickly as, I hate to do this because what you're saying is so important, but we're so short of time.
Yeah. So I think the last thing I would say is that our effort is focused on really training trainers of tomorrow, education and training, training people on hospital management and operations, and making sure that we continue to push the front lines in terms of the best way to take care of our people. We're involved in about 5 hospital projects now in Nigeria, and I think there's more to come. Thank you.
Prophet Wale Suleiman, thank you so much. Congratulations. You can see, even though Zoom has been helpful, it's just not enough. We still need to be face to face because, again, we have to rush. So I'm so sorry, guys, but I am going to be looking at the clock. We're halfway through, so if we can keep it to 2 minutes, I know it's ridiculous, but we're going to have to. I'm going to pass over now to a very patient lady, our next recipient. She's been online for quite a while, Mabe Fang. She's a clinical research specialist, well versed in phase 2 to 5 global study management. I won't take up too much time. I'll hand over to our next recipient. Congratulations, Mabe.
Thank you, Juliana. I'm going to be really quick because I know how Zoom works. So thank you, Mary, for it's humbling to actually be recognized. And I'll take this opportunity to thank the First Lady of Kebbi State, because we're actually one of those partners that have partnered with her with cancer care. So thank you very much for that. So I'm currently based in Abidjan, and my role is Head of Market Access for Roche Pharmaceuticals. I've worked with Shalom, and I will not give you a project specifically, but I'll just tell you what the vision is. The vision really is the patient journey in Africa. Africa has huge opportunities. We want to change the perception about, corruption and all of that. There are good people in Africa. There is expertise in Africa. So let's try to change the narrative and actually ensure that all our patients, inclusive of myself, I could be a patient. We could all be patients. How do we ensure that we have standard of care? And Roche's vision is the patient journey. How do we support the ecosystem? And maybe it's time for us to start tailoring decisions and healthcare to the African setting. So touching on the piece around culture. So how do we embrace that culture and ensure that we are not disregarding it, but giving every patient standard of care? So that's the vision. And we're, more people need to invest on the continent, more organizations need to invest. And the other thing that I need to highlight that we're identifying is when we talk about GDP is a great thing. However, we need to start looking at how much of that GDP is spent in healthcare. Because that changes the narrative completely. So we need to have a long-term vision. We need to all invest. We need to all think about the patient and take it personal as well, and then create access to standard of care. So I will save you a few minutes and just give you a snippet of what the vision is.
Wow,
thank you.
Thank you so much, Mabe. Congratulations to you. Please, before we start, can I ask everybody who's not speaking, please mute their phone. Somebody's very busy and is getting hundreds of messages coming in. So please mute your microphone. We're nearly there, guys. Also as well, please do tweet. We're getting a lot of traction on Twitter. This is going live. A lot of people are excited because, of course, healthcare is so important on the continent. Okay, so we're now going on to a very special lady. Our next recipient, Folake Odediran. Folake is the current General Manager of Medicines and Country Lead for Sanofi in Nigeria and Ghana. I'm going to hand over to you, Folake. Nice to see you. Congratulations.
Thank you very much. Good evening, everyone. I'm very happy to be here. But firstly, I really want to thank Mary and her collaborators and everyone that is involved in my nomination. It's amazing how sometimes you're doing your thing, you think nobody notices, but someone actually is noticing. So I thank you for this opportunity that has been granted me. So very quickly, I'm pharmacist. I lead the team at Sanofi in Nigeria and Ghana, and I've been in the industry for about 20 years now. I'm a graduate of Hamadu Bello University, so indeed I was proud to hear Dr. Bagudu speak. And and I was also proud to hear Professor Suleiman, because again, we do have some things going with all these great people. I recognize that our time is very limited. So, but what I would just say is that I think at Sanofi, our purpose is to empower life. I'm not sure it's very easy to try to support a system you do not understand. And I'm not sure it's also appropriate to try to make up for gaps that you do not understand. So at Sanofi, we try to know what the gaps are in the first place, and then we come in with innovative mechanisms to support those gaps. So we do this either through partnerships or through strengthening the healthcare systems or through education. So again, I know our time is limited. I do not want to keep us for too long. Thank you so much for having me, and God bless.
Folake, thank you so much. Very similar to Mabe, actually, in talking about nuance and culture. It's so important, isn't it? We're not all the same. And Mary, you can see as time is running short that we must still do this awards in person because we need it. There's so much for us to say. I'm moving on now to Professor Francine Ntumi. Is Professor Francine on the line? She is the founder, chair, and executive director of the Congolese Foundation for Medical Research in the Republic of Congo. Is Professor Francine here?
Yes, good evening. Yes, good evening, everyone, and many thanks to Mary for the leadership in this initiative. I will be very short. It's quite a very, exciting, amazing evening, and thank you for my nomination. And I'm building health research capacities here in Brazzaville, in Congo. I'm working on infectious diseases, malaria, TB, HIV, and now.
Sorry, Francine, not me.
Sorry?
Francine, can we put the spotlight on Francine, please?
Francine hasn't got her camera activated.
Oh, okay, that's
sorry, the bandwidth is not good at the moment. So, so from Brazzaville, yes, I'm currently working on COVID-19. So I'm doing the lab diagnosis for the country. We are involved in seroepidemiological studies, and also we are conducting a social investigation among health workers. So yeah, that's it. And I really see this COVID-19 opportunity for showing our African leaders how supporting health research is important. They really have to put funds, money on the table for assisting, for helping African scientists to be able to do the job and to provide answers, and not always expecting answers from the north. That would be my last word. And thank you everyone for the support and for this really amazing evening. Over for me.
Thank you, Professor Francine. Financing African scientists, that's vital, isn't it? I saw Shalom really nodding her head in agreement there. I think we're all in agreement with that one. Now over to Dr. Tosin Majekodunmi, who is the Medical Director and Chief of Cardiology at Eurochem. Handing over to you, Dr. Tosin. Congratulations.
He's not in the room at the moment.
So we will go on to our next recipient, Professor Friday Okonufwa, who is a professor of obstetrics and gynecology at the University of Benin.
Okay, he is in the room.
Okay. David, we'll just mute you, David.
Yes,
Professor Friday,
I am in the room.
Brilliant.
I'm in the room. Thank you very much. I want to very especially thank officials of the Zenith Global Awards for giving me this opportunity. But I want to say, I'm not used to being called upon to talk about my work. But I want to suggest that if anybody wants to know what I've done, perhaps they should just Google me or check Google Scholar on other platforms, and my work will be very visible internationally. I want to say that I'm an obstetrician gynecologist with special interest in reproductive health. And right from the time that discussion around reproductive health came into the world around the 1990s, I've been in the forefront of those working to promote reproductive health in the African region. I established the Women's Health and National Research Center for Research and Advocacy on matters related to reproductive health in 1995. I established the African Journal of Reproductive Health, which is now African Sleazy Journal in Reproductive Health. I was Executive Director of the International Federation of Obstetrics and Gynecology between 2005 and 2007, during which I led programs promoting reproductive health in the 113 world countries of FIGO. And between 2006 and 2007, I was advisor to President Olusegun Obasanjo, during which I learned a lot of lessons and brought consciousness to the field of reproductive health, to policy making. And that led, for example, to the establishment of the midwifery scheme in all the states of the country, in order to ensure that midwives are available in hard-to-reach populations, as well as the about 18 states at that time were able to make maternal and child health services, because maternal and child health services account for about 70% of the disease burden. I went around the states, and I'm happy to say that at that time, 18% of all the states of the country, or 18 states of the country were able to offer free maternal and child health service. Today, I am the center leader of the Center of Excellence of Reproductive Health Innovation at the University of Benin, at which we are training undergraduate and postgraduate students in various fields: public health, reproductive health, nursing, and health economics. Especially these are fields that are so important to build capacity for indigenous Africans to handle matters related to maternal health in the African region. I recently received a grant from the World Bank to also establish a new center on sustainable development. So I believe that very strongly that what I'm doing now is to do research and advocacy to propel health development in the African region. Additionally, I'm leading the training of graduates from across West African region, Kenyan countries like Malawi, Ghana, Guinea, Cameroon, Republic of Benin, etc. are some of our students that we're training to take up the practice of rural health. So on that note, I think I'll end here.
I believe.
And as I said earlier, my work can be found anywhere in the internet. Thank you very much.
Thank you, Professor Friday. You're a very busy man. Congratulations to you and good luck with all of the initiatives that you're working on. Unfortunately, our next recipient, Joke Bakare, was unavailable, so she is not here this evening, but we congratulate her. And I believe that we may actually be coming to our end of the recipients. Mary, is that all? It seems to. It is.
Thank you very much. There's a few questions if you want to go through a couple of them, because people's been raising their hands for a while, and I think we should just address some of the questions.
No. Some are present, they didn't show their video, so they didn't.
Apologies. I believe that some of the questions, because we have various hosts, may be only visible to a few of us. So what we're going to do before we climb onto Q&A, I believe we're going to do the presentation of the Lifetime Achievement Award. I will be handing over to Mary, who I believe will be able to provide some information about this revered individual who we are all celebrating this evening, and we hope we'll be celebrating in person, if not later in this year, very early next year. Mary, am I able to hand back over to you?
Can you hear me?
I can hear you, Mary.
Okay, okay. Good evening once again, everyone. Dr. Kunle Hassan is not able to join us, but Feyi Hassan is here to represent him and tell us a bit about his work. He's a pioneer ophthalmologist, and he received the only Apple TSO Awards in Africa. And his organization, through clinical and philanthropic work, have trained a lot of doctors, ophthalmic nurses, and even middle grade healthcare professionals in Nigeria. They hold regular outreaches. They've distributed like close to 1 million glasses. They've done outreaches and they've helped a lot of people to maintain their eyesight. His main focus is to eradicate preventable eye loss, which I think is very important because usually it's due to lack of knowledge or negligence or ignorance. So that is a vital work in the society. Is Feyi here? Because I did send a message to her to raise her hand.
Yes,
so
I am. Yes, I am.
She can speak now.
Okay.
Hello, can you hear me?
Is she live or on the
yes,
audio?
She's on all.
Hello, can you hear me?
Yeah, we can hear you.
Okay. First of all, I must give apologies for Dr. Hassan. He would have loved to be here tonight. Unfortunately, he was unable to be here, but he has asked me to represent him. And I just have to say thank you to Mary and to Zenith Global Health Awards for presenting him with this Lifetime Achievement Award. And thank you for whoever nominated him as well. He is very overwhelmed and happy to receive this award. Just a little bit about Dr. Hassan. He trained at the Zenith Institute of Ophthalmology, Western Infirmary in Glasgow in Scotland, under Professor Wallace Folds. And he came back to Nigeria in 1993 after spending time in the UK, the US, and the Middle East. And he set up iFoundation Hospital Group. So iFoundation Hospital Group has been in existence for 27 years. And his vision was to eliminate avoidable blindness through the provision of equitable, qualitative, quantitative, and affordable eye care to all. And he did this by first setting up the hospital, but also setting up the first private eye training institute. And iFoundation has been able to train numerous doctors, over 60 local and international ophthalmologists, residents, and fellows. We've also trained over 100 community ophthalmic nurses and over 250 mid-level ophthalmic practitioners. And so we have been able to have a small and hopefully impactful reach in eye health. And this, I think Dr. Hassan would very much say that while he is honored to receive this award, he really would dedicate it to those that he works with, all the consultants and all the staff and residents, nurses, everyone within iFoundation, because we wouldn't be able to do it without each other. So he's very honored to receive this award, and he would be very happy to accept it in person whenever this is the Zenith Global Awards is able to hold. Thank you very much.
Thank you very much. Thank you very much to absolutely everybody. Thank you so much for your patience. I'm so sorry that we had to rush through. Again, I'm going to blame it on the technology. We did put this together pretty much at the last minute, but as Mary loves you all, Mary does want to stay online just a little bit longer, so we can ask some questions. And I understand, because the resources, the wealth of knowledge we have here is humongous, and we usually can't get all of you in the room at once. And so I believe, before I do hand over to Mary to give a vote of thanks, there will be just 2 or 3 minutes for all of our viewers to ask a couple of questions. Please type them now. I will only be asking 2 or 3. There's one in here at the moment from a Margaret Tommy Adegoke, who wants to know, what is Sanofi Pasteur doing on immunization of children in Nigeria? I think we can open that to the panel, if whoever wants to take that.
Folake.
Okay, thank you. This is Folake. I'm General Manager and Country Lead for Sanofi. So a lot of things, we have a lot of things ongoing. We have partnerships with both public and private sector. For immunization of children, we have the ones that it's from the private vantage, and we have the public one through Gavi. So again, it's a very diffuse question, if I may, but yes, we have a lot going in that regard, and we're very much involved, both with the public and the private.
Yes, and to speak for them, they do work with, on this side of it, they work with different organizations, with government, and we're about to enter into different partnerships with them, like in Kebbi State, to enhance that process. So I'm a living witness to that, and Roche as well. So all the big pharmaceutical companies, we tend to work with them. In the cancer space, like Mabel mentioned, they offer different forms of incentives that can be passed on to the patients so that they can benefit from it through foundations like ours.
Thank you, Dr. Bagudu. Thank you so much, ma'am. Your Excellency.
Excellent. Hopefully that answered Adekoke's question. I cannot see any questions here, but just to throw it back open to the panelists.
Oh,
are there any? Oh, sorry. No, please, Mary.
No, carry on. You want me to put back the question?
I saw one question. Are there any other questions? If not, I was.
The question is about the category nominations after the event, and yeah, I think we're going to talk about that at the end, isn't it?
Will we receive an email attachment of the category nominations after the event today? I believe that is a potential no, although there will be some information going out advising on how you can nominate individuals or organizations or practices, which will be sent via email. And apart from all of the congratulations which we've been flooded with, I believe that that's it. And so again, this is a last opportunity if any panelists should, Emily Moore would like to know, how do you see digitalization changing the landscape of clinical practice in the future? Good question. I'd like to know the answer to that too. I think we'll just throw that out, whoever wants to take that.
She just put it in.
Hello.
Who would like to answer that?
Hello.
We can hear you.
This is Professor Wale Sulaiman.
Yeah.
I think that as you've seen with telecommunication, Sub-Saharan Africa is going to leapfrog when it comes to healthcare. And technology is going to drive the significant changes we would expect to see in healthcare. I think telemedicine, digital health, and even using AI is going to allow us to bridge the significant gap between healthcare in Sub-Saharan Africa and the Western world. So it's going to play a significant role. Thank you.
Thank you, Professor. I think now I'm going to finally hand over to Mary. I want to thank you all so much. Thank you for being patient with me and my Oyimbo, as they say, and my non-addiction of healthcare. You've all been very patient. You're all such amazing individuals. Thank you so much for all of your hard work. And I really do hope I can see you soon. Thank you so much, Mary, for inviting me. I've learned so much, and I'll be passing over to you now. Thank you.
How do you do it? Okay, come on, do this.
Thank you very much, Juliana. This is great. And thank you, for your hard work. Thank you to everyone at Zenith Global Health. Because I say this year in, year out, Zenith Global Health team is the smallest team in the world doing amazing things, especially because we all have a daytime job, if you like. So we're doing this out of passion. This is a social enterprise, not a business. So even if we get support or sponsorship or whatever, it will go into making the next event even more amazing. So I'm indebted to everyone at Zenith Global Health for their time, going to bed late, waking up early to make sure this happens. Thank you so much. And congratulations to all our recipients. I mean, I don't know where to start. I promised myself I'm not going to well up, but when I see this lineup, listen to what you all have done. I mean, I have an idea, snippet idea, some that I've worked with, some from nomination, but it's nothing compared to even the 2 minutes, which is like, it's not even up to the tip of the iceberg that you have shared with us. So we congratulate you, we celebrate you for upholding excellence in healthcare. And at the same time, we thank our category nominees as well. And you will agree with me that we're doing great across Africa from the array of nominees. And during the pandemic, we actually stopped the nomination campaign. So we thought it's fair that we give people the opportunity to even showcase more amazing healthcare professionals, especially because we're still going to host this in Lagos. We are coming to Lagos. And that is when we'll be actually giving our recipients the opportunity to talk about their work and, to share with us in depth what they do. Of course, as time goes on, we will share with you the plans And once we have a confirmed date, we'll let you know what date it is. I said this platform is about collaboration. So one of the things I'm doing with the trust is we call it reset and recharge. So all our patients that's recovered from COVID-19, some from the 2000 that we look after in my trust alone, we are following on with them to see what complications and what supports are available in the community. So if anyone wants to do something similar or anything at all, please get in touch. We are happy to signpost, support, give advice, and you know, whichever way we can help. Because this is the way that we can transform and sustain excellence in healthcare. I can go on and on because I'm so excited. I'm looking at the attendees from America, from UAE, and I'm proud to say that nearly all the states in Nigeria are represented here. So thank you so much. And from Africa, from Ghana, from Congo, Tanzania, Zambia, I'm seeing all of you here. Thank you so much. I wish you all the best. Have a nice evening and look after yourselves, because I know that healthcare professionals, we always look, you know, put ourselves back. And everyone working in social care as well, you know, if you are involved with patients, you put them at the center and tend to like put yourself somewhere in between. So let's take very good care of our well-being. And thank you to eMQT